my name is Gina Patino, and my speech is on rheumatoid arthritis. Ring, ring, you get up to answer the phone, and as you are walking with each step of the way, your joints are aching and you can barely make it to the phone. This is the life of a bad case of rheumatoid arthritis. Arthritis is any condition that changes a joint or interferes with joint motion. My intention for this speech is to inform you what causes arthritis, who does it affect, and is there any way to cure it and make the pain feel less? I picked this topic because many of my family members suffer from this disease. And even though it kills me to say, I have seen this at first hand and the pain people go through. Their hands get stuck like this, their feet, they can't move, their joints hurt. It's just terrible. After much research, I have learned about the symptoms and exactly what people go through. Let's begin with what causes rheumatoid arthritis. More than 2 million people in the United States suffer from rheumatoid arthritis. That's about 2 out of 100 adults. In the book Rheumatoid Arthritis, FAQ, by Eric Montos, he states that there is not a clear cause of rheumatoid arthritis. People believe it has to do with how your immune system is working. Rheumatoid arthritis is an autoimmune disease, meaning that when you have this disease, you will have an abnormal immune system. The immune system usually works like this. The immune cells in your body are there to protect everything that's coming out from the inside. When they start recognizing that their disease, it just doesn't work and it just multiplies and multiplies in the human body. Researchers also believe that the gender made a major role in the rheumatoid arthritis. In tests and records, these diseases affect twice as many women as men in the age of 20 to 50. Even though the disease can affect anyone at any age. Moving right along, now that you understand that people that have a higher risk of getting this disease and what possibilities cause the disease, you might start thinking, what part of my body will hurt when I have rheumatoid arthritis? The symptoms that may occur when you have RA and the parts affected are the following. Generally, the joints more frequently involved in the RA are the hands, wrists, knees, and feet, but any joint can be affected. To most people, arthritis means pain and stiffness in the joints. Indeed, if you trace the words arthritis to the Greek roots, you will discover that it means inflammation. Although not all types of arthritis have necessarily had to come about from inflammation, RA is a form of inflammatory arthritis, being the type of disease that inflammatory is cause other problems too. People with RA often have the symptoms as fatigue, low fevers, decreased appetite, and depression, muscle aches. Now that we have established the possible effects of the RA disease, here are more facts you may want to know to have a fuller understanding of the pain these people go through. More information about the disease and one condition that is often confused with RA by patients and physicians. A couple facts about this disease is RA is referred to as a chronic illness because it can last for months and months or even years. RA affects the body symmetrically, meaning the arthritis on one side of the body matches the one on the other. According to Dr. Tammy and her team, one condition that often is confused by people is called osteoarthritis, also known as the degenerative joint disease. OA is much more common than RA, affecting about 16,000 people just alone in the United States. With this in mind, remember, make sure if you even start having joint pains, you know which disease you have. The one is less pain than the other. Keeping these points in mind, if you are 100% sure you have RA, here are some ways to control the pain and try to get rid of the disease before it progresses. Looking for treatments, because with this pain, how will you live? The main treatment goal with RA is to control inflammatory and slow or stop progression of RA. Treatment is usually a multi-phase program that consists of medications, occupational or physical therapy, and regular exercise. In understanding RA, articles by WebMD, the medication most prescribed is called non-steroidal anti-inflammatory drug. This helps the pain towards the ones that are already torn joints. To actually stop more damage, the drug is called disease-modified anti-rheumatoid drug. If you are ever diagnosed or know someone that is, don't become uneasy. There is medication and therapy to help to cope with the pain and even help make it disappear if the treatment is done with time. I hope this speech helps you understand what rheumatoid arthritis is all about and who it affects, what kind of symptoms you may be dealing with. Also, don't forget, with a little exercise every day, starting right now, you will help decrease the chances of getting this painful and curable disease. So just remember to have a little bit more sympathy towards people with the disease. Just imagine of such pain they go through every day doing things you take for granted, like getting dressed in the morning or just walking to the door. Help them out in any way you can to make their normal day less painful.